historically for decades, we've been stopping bleeding all over the GI tract and not just, but GI tract specifically. And someone actually in France, Dr. Vidal, and he needs the full credit here, in about 2010, started that treatment of what we call hemorrhoid artery embolization and developed a technique called Hemorrhoid technique. But essentially, it's the same technique we use for embolization of any bleeding in the GI tract with some modifications to tailor for internal hemorrhoids. And over time, we built enough evidence to show that this procedure is actually much better tolerated by patients, right? Because it doesn't involve instrumentation. It's certainly much more better tolerated than something called hemorrhoidectomy, like your dad said, which is kind of the end spectrum. And some people do need that, especially for grade 4 hemorrhoids, but it is a highly morbid surgery that many of the patients I see describe as a worst experience of their life because of how painful it is, right? And some of the other potential complications, like Dr. Yaseen mentioned, which is incontinence and issues that come with the hemorrhoidectomy. So this is kind of a procedure that fills a nice void for patients who are definitely afraid of the surgery and want to avoid surgery at all costs. And I've seen patients who've been suffering for years or decades with this just to avoid. Yeah, definitely. A lot of people suffer in silence, and you're just amazed every time. I see a lot of these people, and I see a lot of those patients, and I know a lot of people change their lifestyle drastically just so that they don't end up bleeding out, so that they require the hemorrhoidectomy. So this procedure through the blood vessels, like any angiogram that would be performed, and it's from a standpoint of view of an interventional radiologist, it's one of those more relatively straightforward procedures to perform. Doesn't require some tremendous fancy sort of high technical sort of skills. I would say it's a procedure that average interventional radiologist can perform. It just needs to recognize when to come into the clinical spectrum, when you can actually help the patients, recognize that the disease process is not just a nail and you're a hammer. There's a whole spectrum, right? Like you want to talk about the fact that, yeah, we can treat those internal hemorrhoids and shrink them and shrink the tissue and stop it from bleeding. But if you don't do anything from lifestyle standpoint of view, they will recur, right? This is a tissue that we're not taking away. So we need to emphasize to our patients the fact that we want them continue and emphasize changing their lifestyle, preventing constipation, trying to lose weight, and doing all the right things from lifestyle choices, because those things will come back. Now, the recurrence rate for this procedure is definitely better than the Doppler-guided ligation or rubber bending. And we say it's about anywhere between 85 to 90% recurrence-free at 1 year, although, evidence and some of the studies show maybe 80 to 90, but definitely better from a standpoint of view of the other less invasive gastroenterological options.